Good morning. Today we're going to be doing an assessment of the head, ears, eyes, nose, and throat. Deja is going to be my patient for today. Let's get started here. All right. When we get ready to start this assessment, we'll check our patient. First thing you want to note upon arrival, the skin condition of the patient. She doesn't look flushed, any red in areas. She's got a nice even tone. She doesn't have any blue areas to note any cyanosis. So everything as far as the outside appearance looks great. First thing we want to do is to let the patient know before we touch them that we're going to be doing an examination, and I'm going to be touching your face and your neck and and your back area and your neck. So first thing I'm going to do is palpate the head for asymmetry. We're going to be checking for any deformities, any scars. And while I'm also in the head, I'll be checking the hair for the scalp for any lesions, checking for any alopecia, which is hair loss, or even infestations of lice or something of that nature. So upon examining the hair, knowing that the hair on the head is a little bit coarser than those that are noted on the eyebrows and the eyelashes. She doesn't have any balding spots, doesn't have any scabs or anything, and it's all nice, even hair. Straighten back up. So we're going to palpate the head again, like I said, for deformities, any lumps, any involuntary movement, and any swelling. Also, I'll be checking her neck for any masses or tenderness. While I'm here, I can also check the superficial lymph nodes, the submandibular and the submental, the anterior cervical, as well as the periauricular and the postauricular. So while I'm here, I also check for TMJ. Please open your mouth. Close, open, close. And at this time, we're checking for any loss of range of motion or any crepitus. We're going to be checking her cranial nerves. The first of which is going to be the olfactory nerve. Please close your eyes. Take a whiff. Smell.
Vanilla.
Vanilla. Very good. You can open your eyes.
It really is.
It really is vanilla. Okay. I'm going to check her cranial nerves. The cranial nerves convey your sense of taste. So in doing the not the cranial, the facial nerves convey your sense of taste. Also going to check the optic nerves, and in doing so, I check her eyes for pupil reaction to the light to make sure that they're equal in reaction to the light. Checking for any cross-eyed, which is strabismus, or any anosorica. I'm going to check the eyes for any swelling noted. Check inside the eyelids. I'll pull them down. I look, they're nice and pink. Check the upper eyelid for the same. Okay, sorry.
Okay.
And I'm gonna have her to look straight ahead. If you will, look up. Look down. I'm also taking note of the shape of the eyeball. Checking the sclera and the retina. Okay, follow my pen. Okay. divided her a little bit there. Gonna check the trochlear nerve. Gonna place one finger over her ear and I'm gonna whisper a word.
Red Bull.
Okay. And we'll check this side.
Cat dog.
Okay. Oh, I did that wrong. I'm sorry. Let's try again.
ABC mouse.
Okay. All right. At this time, gotta do inside your nose. I do not have an otoscope or the ophthalmic scope, but with those instruments, the light provides a field of vision so that I could see with the ophthalmic scope, see the back of the retina and everything in the eye and check the nerves there as well. I'll simulate using the otoscope to check her nose and to check her ear. For the nose, with the speculum on the tip, you would want to check inside the nostril. You're checking for any bogginess, any pale color, lesions, and any drainage. And also you want to check for a deviated septum to make sure that it's not leaning to one side or there's not a hole tunneled through the septum there. So you check both sides there. If I were checking the eyes, the ears, with the otoscope in place and the speculum on it, on her right ear, the cone of light would be at the 5 o'clock position. On the left ear, the cone of light would be at the 7 o'clock position. And both of these will be noted as you're checking the eardrums of your patient. For all intents and purposes, her eardrums are great. Okay. And while you're checking the ears, you can check for uric acid buildup. That's little tophi that are located. They would be located right along the top of the ear, and it's just a hard calcified buildup of the uric acid, and it would be located just outside the top of the ear. All right, now we're going to check inside her mouth. We're going to be looking at the hypoglossal nerve. I'm going to have her open her mouth, stick out your tongue, take it to the left, to the right, hold your tongue up, 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 there you go. Once I'm here, I can note veins. Also inside the mouth, I will check the teeth, checking for any cavities, checking for any broken or missing teeth. Got some nice teeth there. All right, here, checking her lips to make sure that they're pink. The the mucous membranes inside are also pink. Making sure that they're not cyanotic, which would mean that she was deprived of air at some point. All right, cranial nerve 9. Just have her open her mouth and say ah. That's the glossopharyngeal, and that one's fine. Cranial nerve 10. See if she can swallow or speak without being hoarse. Swallow for me. Okay, and as I'm checking this, since I'm here, I can check her thyroid at the same time in her neck. And I'll also check to see if the esophagus is midline, or see if it's deviated. Swallow for me. Stand up. And I'd actually check the esophagus, seeing if it were deviated. And I can push from one side to the other. Doesn't cause her any pain. And it is in place. You can have a seat. Okay. And cranial nerve 11. I'm going to have her move her head from side to side. Go to the left. Go to the right. Now, if you will, shrug your shoulders up and down. Is there any pain in doing so?
No, ma'am.
Okay. Also, we're going to put her head at a 45-degree angle. And I'll be checking for jugular vein distension. she's good on both sides, and I'll check those superficial notes again. Okay, this concludes my video of a head, ears, eyes, nose, and throat assessment. Thank you.